Hi, this is Dr. Madhu, consultant senior surgical oncologist and robotic surgeon from KIMS Hospitals. Today we will be talking about breast cancer. Breast cancer has become a relatively common disease among the women. Most of the women around the age of 40 years are presenting to us with complaints of lumps in the breast, most of the times painless and diagnosed with breast cancer, getting alarmed. And most of the times these patients are come under the category of treatment and they can be cured. In the case of breast cancer patient, most of the times they present a painless lump in the breast, which might have been there for some time. They might not have shown to the clinician, and the awareness was not good almost 5 to 6 years back. Recently the awareness is good. But this lump, when they present to you, a clinician should evaluate and explain them properly what is the significance of painless lump. For example, if a lump is associated with pain, most of the times the lump is harmless, and they may present with nipple retraction, nipple discharge, mostly bloody nipple discharge, and they may also present with swellings in the axilla associated with this lump. Sometimes there may not be lump in the breast, the patient may have swelling in the axilla. So these kind of varied presentations are there for breast cancer. So the most common presentation will be a painless lump accidentally noticed by the patient in the recent past, and they present with that lump to the clinician. So increasing the awareness of breast cancer in these patients will allow them to present early. How to increase the awareness means we need to conduct regular screening camps and big cancer awareness programs like marathons, cancer walks, all these things. With these things, the patient's awareness becomes better and they may present with a lump which is of smaller size, and in these stages, if you treat the patient, there is high chance that the patient can be cured. So all this time I have been explaining the presentation of a breast cancer patient and why this lump happens in women. That is the most important. So breast cancer predisposing factors, certain factors are there which predispose to breast cancer, like nulliparous women, the woman who doesn't have children, women becoming pregnant at a late age, that is more than the age of 35, and women who have the habit of smoking, alcohols, and any significant family history. If I come to the family history, we need to be more specific, and any affected first degree relatives, her mother, her sister, her mother's sister becomes a second degree relative. So any first degree relative or second degree relative getting affected with breast cancer, these women have the high chance of inheriting the breast cancer. So this is how the inheritance of breast cancer happens in a woman. And I told certain situations like nulliparous women, elderly primary. And these are some risk factors. For example, patient who is breastfeeding the child, it's a protective factor to prevent the breast cancer. Breastfeed the children. And fully parous women are protective phenomena. So early menopause, early menarche and late menopause. Early menarche, the menstrual cycle starting period is called menarche. Early menarche and late menopause, elderly primary and nulliparous women, women who use more contraceptives, and the inheritance, family history of breast cancer. All these things are very important. These are all considered as most risk factors for causing breast cancer. So when a patient presents to you as a clinician, we need to examine the patient once clinically. Once we examine, we will understand the size of the lump, the contact, the surface, and based on the examination findings, we will understand whether we can go for a surgery or a medical management. So this is based on the clinical examination. Once you complete, the patient will be sent to a radiologist, a mammogram, ultrasound breast. In these two investigations, there will be a score. Based on the score, it will be described like M1, M2, M3, M4, M5. So the M5 is cancer, M1 is a benign lesion. So based on this score, we will have an idea that whether it is a breast cancer or a lump which is harmless, which is benign. So after doing this mammogram and ultrasound, the next step is proceeding to a diagnostic investigation. That can be a needle test like FNAC or a biopsy, core needle biopsy. So with these three investigations, that is clinical examination, radiological assessment, and diagnostic investigation, that is FNAC or biopsy, we consider it as called triple assessment. Based on this triple assessment, diagnosis of breast cancer is done. Diagnosis is established now. Now, whether to proceed for surgery or any other kind of treatment, we need to stage the patient. Staging the patient is done by a chest evaluation and abdominal evaluation, either by a PET scan or a contrast CT and ultrasound abdomen, or sometimes if we don't want PET scan, contrast CT chest and bone scan are enough. Now I just explained how it is diagnosed and how it is staged. So most of the times there are certain treatment options for breast cancer like a surgery, chemotherapy, radiation, hormonal therapy, and immunotherapy or targeted therapy. So based on the stage of the breast cancer, we channelize the treatment. We triage the treatment, line of treatment. We generally stage breast cancer according to the stage, like stage 1, stage 2, stage 3, stage 4. Stage 4 is metastatic. That means the cancer has spread to the distant organs from the breast, like lung, liver, bone. These situations, like metastatic breast cancer, the surgical option is ruled out. The patient will go for chemotherapy. Now, when we are going to do surgery, surgery is applicable for early breast cancer. Early breast cancer is considered as stage 1 and stage 2. Stage 1 and stage 2. That means their patient will have a small lump is we will be doing the surgery. One is complete breast removal and the other one is breast conserving surgery. So all the types of reconstruction will come under breast conservation surgery, which we considered it as oncoplastic surgery. So the complete breast removal is done for patients who don't want this breast conservation surgery. So the options of breast conservation surgery and what are the indications of breast conservation surgery should be explained to the patients, and the patient should be properly counseled about these two options, and we have to leave the opportunity to the patient for them to select whatever the kind of treatment they want. And now the thing that is left is stage 3, that is locally advanced breast cancer. In this scenario, we are not going to operate, we are going to give chemotherapy first to downsize the lump and facilitate the surgical management in the future. So after completing the surgery and chemotherapy, the patients will be receiving radiation as required, and that will be followed by hormonal treatment based on the receptor positivity. To avoid breast cancer, that's what I want to elaborate now. As I already mentioned, breastfeeds our children, it's a protective factor. Multiparous women having many children, it's a protective factor. And she should quit the habits like smoking, alcoholism. The history of familial breast cancer, that is, her mother got affected or her sister got affected with breast cancer. It is important for the clinician to do BRCA analysis. It is a gene, BRCA is a gene. We generally do the analysis in the index patient and her relatives. Suppose if the index patient, the BRCA is positive and the first degree relative BRCA is positive, then it is better to explain the first degree relative about the prophylactic surgery. They may undergo as a prophylactic bilateral mastectomy and bilateral salpingo-oophorectomy. This helps them to prevent from the future breast cancer development. This also can be considered as a precautionary measure to prevent breast cancer in future. For example, a patient underwent breast cancer surgery now, and we didn't do any BRCA analysis because she didn't have any family members got affected with breast cancer. But if she is a young patient, we did a BRCA analysis, and then she should be advised about bilateral mastectomy and salpingo-oophorectomy. These are certain precautionary measures to prevent breast cancer. And sometimes a obese person, obesity is also one of the cause for breast cancer. And in some diabetics also there is some high incidence. So controlling diabetes, controlling obesity, controlling the significant family history factors, precautionary measures for breast cancer.